The Pre-Hospital Emergency Care Council, PHECC, is the regulator for emergency medical services in Ireland. PHECC is an independent statutory agency with responsibility for standards, education and training in the field of pre-hospital emergency care. The Pre-Hospital Emergency Care Council protects the public by independently specifying, reviewing, maintaining and monitoring standards of excellence for the delivery of quality pre-hospital emergency care for people in Ireland. PHECC is governed by council whose members are appointed by the Minister for Health on the basis of their involvement and expertise in pre-hospital emergency care. Council is advised and assisted by standing committees made up of council members, health industry and community partners. The committees are the Audit Committee, the Quality and Safety Committee, the Fitness to Practice Committee, the Medical Advisory Committee, the Appeals Panel and the Education and Standards Committee. The Education and Standards Committee is chaired by Valerie Small. Valerie has spent much of her career in the specialist area of emergency nursing in St James's Hospital, Dublin, where she leads a group of 6 advanced nurse practitioners in the emergency department. Valerie was appointed to the Pre-Hospital Emergency Care Council in 2007 and currently chairs the Education and Standards Committee and the PHECC Appeals Panel. Valerie outlines the role of the Education and Standards Committee.
The Education and Standards Committee is a standing committee of the Pre-Hospital Emergency Care Council, and it makes recommendations on policy matters that concern the council business. A number of those policy areas will be in education and standards for examinations and for awards for the pre-hospital emergency care practitioners in emergency medicine technology. Also to make recommendations in relation to continuous professional development for the profession, and also to recognise institutions of education and training where training for pre-hospital emergency care practitioners would occur, and that would be for emergency medicine technology, paramedics and advanced paramedics.
Here's how the Education and Standards Committee is made up.
The Education and Standards Committee is comprised of 16 members, and those members broadly represent the patient and the service user, represent community groups, the recognised institutions for education and training of the EMT, paramedic and advanced paramedic, representatives from adult education, nurse education and medical education. Also represented on the committee are the Northern Ireland Ambulance Service and the chairs of the standing committees of the Pre-Hospital Emergency Care Council and the chair and vice chair of council.
Finally, Valerie sets out what the committee hoped to achieve during its tenure of office.
Well, the Education Standards Committee hopes to achieve the review of the education and training standards, implement a framework for continuous professional development for the practitioners, see the transition from the current education and training format for paramedics and advanced paramedics move to the third level institutions, and the development of the examination process from within the Pre-Hospital Emergency Care Council per se to other appropriate agencies.
For more information about the Education and Standards Committee, log on to www.phecccit.ie.